Welcome to Medicopoint. In this video, we will cover all the past year questions of Practice of Medicine Paper 1, including 20 marks, 10 marks and 5 mark questions. Let's start our complete PYQ analysis. 20 mark questions. It includes hemorrhoids, chronic bronchitis, pancreatitis, bronchial asthma, peptic ulcer, cirrhosis of liver, COPD, irritable bowel disease, portal hypertension. Then pneumonia, ulcerative colitis, abdominal tuberculosis, chronic pancreatitis, pneumothorax, Crohn's disease, and ascites. 10 mark questions include causes of hepatomegaly and indication of cyanosis in liver disorder, clinical feature of AIDS, and role of susceptibility in treatment, bryonia in pneumonia, causes, feature and indication, differential diagnosis of GERD, and indication of Noxomica, clinical presentation of IBS, and indication of Noxomica, peritonitis, its causes, feature, indication of apocynon, hemoptysis, its causes, indication and lycosis, loss of weight, causes, indication of alfalfa, pneumonia, its type and feature, indication of Cilicia, chronic pancreatitis, its feature, indication of iris versicolor, causes and feature of HIV, role of susceptibility in treatment, causes and feature of GERD, indication of natrum cell, splenomegaly, its etiology, indication of Cyanthus, asthma, its type, feature and indication of medorinum, features of hepatitis B, role of susceptibility, causes of vomiting, indication of phosphorus, causes and feature of peritonitis, indication of belladonna and bryonia, causes of splenomegaly, indication of cedron and sena officinalis, causes and feature of ascites, indication of apis mellifica and apocynon, causes and feature of COPD, indication of Drosera and Rumex, portal hypertension, its causes, complication, indication of Cardus-Murr and Helberus, SLE with toxicum and causticum, GERD, its causes, feature, indication of Lycopodium and Noxomica. Then primary pulmonary TB, indication of tuberculinum and Cilicia, malabsorption, indication of Alois Sock and Sena officinalis, pneumonia, its type, feature and indication of antimonium tard and dulcamera, acute pancreatitis, its feature, indication of belladonna and conium, lung abscess, causes, complication, indication of bacillinum and hepar sulf, cholelithiasis, its feature, complication, miasmatic background and chronic prescription, IBS, its causes, feature and miasmatic note, pneumonia, its etiology, feature, miasmatic background with 2 drugs, hepatitis B, its feature, complication and susceptibility, pleural effusion, indication of bryonia alba and calicarp, gastritis, indication of IBS can and argentum nitricum, cholelithiasis, indication of Staph aureus and Lycopodium, cancer of pancreas, indication of hydrastis and thuja. Let's move toward question number 2, 5 mark questions. Organophosphorus poisoning, rheumatoid arthritis, diagnostic criteria and deformities, Down syndrome, clinical feature, forced bite, its etiology, general management, jaundice, types and differential diagnosis, emphysema, etiology, clinical feature, ulcerative colitis, causes and features, bronchiectasis, its clinical feature, dwarfism, clinical feature, upper GI bleed, its causes, hyponatremia, jaundice with differential diagnosis, hemoptysis with differential diagnosis, then frostbite and its clinical feature, pneumothorax, its type and feature, cholecystitis, causes and feature, Klinefelter syndrome, its clinical feature, dyspnea, ascites, acute gastritis, COPD and Down syndrome. Then move toward irritable bowel disease, dehydration, hepatic failure, miliary TB, immunodeficiency and its type, pneumothorax, types and feature, heart stroke, its causes and feature, then viral hepatitis, its causative organism and feature, community acquired pneumonia, its causes and feature, hemoptysis with differential diagnosis, atopic asthma, its causes and feature, Gallagher-Wilson syndrome, Wilson disease, Turner syndrome, AIDS with related complex, sleep apnea, hypothermia, hematemesis and melena, hepatic encephalopathy, electric shock, copper poisoning, dysphagia, IBS with indication of Noxomica, hemochromatosis and pleurisy. Then move toward the final section, question number 3, 5 mark questions. It includes therapeutics, Cilicia and arsenic album in pulmonary TB, viral hepatitis, role of susceptibility, carbovage and phosphorus in gastritis, chelidonium in cholecystitis, Lycopodium in liver disorder, Sangium and uranium in diabetes mellitus, Hemamelis in mechanical injury, bryonia in COPD, phosphorus in cholelithiasis, belladonna in SLE, veratrum in GIT complaints, camphor in acute gastroenteritis, lycopodium in viral hepatitis, arsenic alba in peptic ulcer, aurum triphalanum in allergic rhinitis, carbovage in dyspepsia, ruta in rheumatoid arthritis, podophyllum in diarrhea, lidum pali in punctured wound, rustox in ankylosis spondylosis, robinia in gastritis, glonoinum in sunstroke, heparsulf in pulmonary TB, chelidonium in liver abscess, phosphorus in hepatitis, cocculus in seasickness, cantharis in burn, chelidonium in gallstone. Then abrotanum in malabsorption syndrome, natrum sulf in bronchiectasis, heparsulf in chilblains, bryonia in chelidinium in acute cholecystitis, rumex in acute bronchitis, phosphorus in hematemesis, mercurius in autoimmune hepatitis, nitric acid in recurrent stomatitis, Calidas meniensis in biliary colic, calibich in bronchiectasis, glonoinum in heart stroke, bryonia in pleurisy, opium in constipation, aconite in bronchopneumonia, heparsulf in liver abscess, then antimonium tart, bronchiectasis, natrium carb in sunstroke, chelidonium in hepatitis B, crotalus in hepatitis B, opium in constipation, lachesis in hematemesis, medoninum in gonorrhea, heparsulf in pneumonia, and plumbum met in acute peritonitis. These are the most repeated questions. Please don't miss it. Bronchial asthma, cirrhosis of liver, pneumonia, heart failure, ulcerative colitis, portal hypertension, splenomegaly, peptic ulcer, frostbite. These are the most repeated questions in PYQs. Then high yield system, we have to focus more on it. That is heart, lungs, liver, and GIT. These are the most repeated and asked system. Revised clinical feature, myometric understanding, drug indication, therapies, all are available in our Telegram channel. If you like this video, then like, share and subscribe to Medicopoint for more PYQ question series.